Hey everyone, this is Holly Knutson. I'm a functional health practitioner from Utah, and today I'd like to continue my cancer series and talk about breast cancer risk assessment and antigen testing and how that works. Breast cancer risk assessment, along with antigen testing, is important for not only monitoring your cancer risk, but for monitoring the disease progression and the treatment response. True Health Labs offers 3 tests that are specific to breast cancer, including a 216-OH urine test and 2 breast cancer antigen tests. And in this video, I'd like to talk about the specifics of each test. But first, how does True Health Labs work? Well, it's a direct access testing company that offers functional lab testing from certified labs both in the U.S. and internationally. It was created by Dr. Brady Hurst, and the lab's mission is to provide direct-to-the-public testing to people who don't have health insurance or who don't have adequate coverage. True Health Labs' belief is that everyone should have access to affordable lab testing, and this includes people whose medical practitioners will not order tests for them for whatever reason, or just for health-conscious people who want to make their own health care choices. Testing can, however, be ordered under the direction of a physician as well. Functional lab testing provides insights into how one's diet, environment, and other lifestyle factors are affecting their short and long-term health. And this is the foundation of preventative and predictive medicine. These insights provide clues into imbalances and dysfunction based on lab ranges and results. And then targeted therapies and protocols can be designed to bring the body back into balance. True Health Labs offers a variety of tests, including vitamin and mineral testing, organic acid and food sensitivity testing, autoimmunity screening, blood chemistry and hormone panels, and infectious disease and genetic testing. But this is just a small sampling of the labs that are available. True Health Labs has made it easier than ever to be in the driver's seat when it comes to your health. Their motto is, "Great treatment starts with great lab testing." Now I want to talk about each of these 3 tests. Number 1, the 216-OH urine test for breast cancer risk by Estronix. This test evaluates risk factors for cancer by measuring estrogen metabolites along with their ratios. The ability to metabolize and excrete estrogen is a significant factor in determining breast cancer risk. Both good and bad estrogen are measured, providing a 2:16 ratio and a glimpse into a woman's risk of developing breast cancer. Higher levels of bad estrogen versus good estrogen are correlated to cancers that are estrogen sensitive. 4 good estrogens are tested. The first one is 2-hydroxyestrone, and that high levels of that protect against cancer. The second one is 2-hydroxyestradiol, and this is also an estrogen that has anti-cancer effects. The third one is 2-methoxyestrone, and high levels are ideal and cancer protective. The fourth good estrogen, or 4-methoxyestrone, is a non-cancerous estrogen that typically doesn't require treatment when levels are elevated. 2 bad estrogens are tested. The first is 4-hydroxyestrone. High levels of this estrogen can damage DNA, which increases breast cancer risk, and the lower the level, the better. The second bad estrogen is 16-A-hydroxyestrone. High levels of this bad estrogen can fuel tumor growth. The ratios below 2.0 are indicative of increased long-term breast and cervical cancer risk, along with other estrogen-related female cancers. Targeted nutritional strategies are useful for raising the ratio, and this will decrease long-term risk. This lab requires 1 single urine specimen, which can be taken at home with the kit provided by mail, and you don't need to fast. This test is vital for women who have a family history of breast cancer or estrogen-related issues. The lab provides suggestions for balancing estrogen naturally to reduce risk. Number 2, the 2729 breast cancer antigen test. Well, what are antigens? They're substances on cells that can be uniquely identified and measured. This lab measures the CA2729 antigen and tumor markers that are associated with breast cancer, and more specifically, stage 4 metastatic breast cancer. It's also used to detect recurring cancer in patients who have already received treatment for breast cancer. High levels of antigens correspond to increased cancer risk. Numbers that are under 40 U/ml are considered normal, with values over 40 suggestive of active or recurring cancers. These levels may also indicate the presence of other types of cancer or even conditions that aren't cancerous. A blood specimen is drawn at a local lab, and fasting is not required. Antigen testing is not typically ordered as a standalone test, but is used in conjunction with mammography and comprehensive blood testing that evaluates liver and kidney function. The test monitors metastatic breast cancer progression and treatment. High numbers correlate with worsening pathology, with lower levels signaling a favorable response to treatment. Levels over 100 are associated with cancer, as is more than a 25% increase in values between tests. Elevated results warrant additional testing, and this would include an ultrasound or biopsy or CT and PET scans. False positives are possible with this test, and levels may be elevated for reasons exclusive of breast cancer, including colon, ovarian, pancreatic, and lung cancer, pelvic inflammatory disease, benign breast cysts, and acute hepatitis. Furthermore, it's normal for antigen levels to rise during the first few weeks of cancer treatment because as tumors break down, they release antigens into the bloodstream, and this would be reflected in the testing. The third test is the CA15-3 breast cancer antigen test. The 15-3 is a serum blood test used in patients who have already been diagnosed with breast cancer. It's not used to diagnose the disease. The test tracks cancer progression and detects signs of relapse in the early stages. The CA15-3 is a cancer oncomarker, and it's normally low in people who are healthy with levels under 25 U/ml. Elevated levels of antigen in the bloodstream are associated with breast cancer, with high tumor marker concentrations correlating to tumor size and metastases. Malignant cell growth is associated with increased antigen secretion, and this can occur months before clinical symptoms manifest. The lab is useful in assessing whether a treatment protocol or therapy is successful, which is reflected by increasingly lower levels of antigen. Conversely, if markers rise during therapy, other treatment options need to be explored and implemented. Interestingly, normal levels don't entirely rule out breast cancer due to the fact that some tumors don't produce the antigen in early stages. High levels may also indicate other types of cancer, including stomach, liver, ovarian, cervical, endometrium, and pancreatic cancer. Moderate levels of the antigen are associated with diseases such as autoimmunity, hepatitis, bronchitis, and benign breast tumors. High levels can also be found in the third trimester of pregnancy. In summary, breast cancer risk assessment and antigen testing is helpful for measuring cancer risk and provides valuable information for designing treatment protocols based on lab results. True Health Labs offers comprehensive and affordable lab testing that doesn't require a doctor's note. They're certainly my go-to company for quality laboratory testing. If you've used True Health Labs, please leave a comment below. Thanks so much for watching.